What should physicians watch out for to diagnose SCA12?
Yeah, when we suspect SCA12, so first of all, if the patient comes to me with tremor, tremor is the most common symptom. Hand tremor is in 90% of cases. And then they say that I have little wobbliness, little difficulty in walking, right? Then the red flag is raised. But when the patient has tremor only, and when we see that patient has clear family history, that father had or mother had, grandfather had, any brother has, then we suspect that something familial is going on. And that familial can be SCA12 or even essential tremor, familial essential tremor. But apart from tremor, any other symptom is there, as we talked, that walking imbalance, then SCA12 is more likely. But more than that, if we see a title, if we see the surname Agarwal or in any surname which indicates towards Marwadi Agarwal family, then we suspect SCA12 high on the list. And in that case, we go for two tests. One is MRI brain, just to see that are we missing anything else? Because ataxia, tremor, walking difficulty and tremor can happen with other conditions of the brain also, like small stroke or some myelin sheath problem, like multiple sclerosis. But if MRI is not showing anything or showing just dryness of cerebellum, mild atrophy of cerebellum, then yes, we might be dealing with SCA12. In that case, a simple blood test for SCA12 is done. The gene test is done to see the particular thing what we call as repeat, CAG repeat. CAG is the code, a genetic code for nucleotide. If we see that repeat more than 43, 44, that means most likely SCA12. So to answer your question, SCA12 is diagnosed on the basis of symptoms, just seeing the MRI to rule out other conditions, and simple blood test, genetic test, which is not very expensive nowadays. It costs about 4,000 rupees also, and that confirms the diagnosis. If gene test is positive, it is SCA12. So there's no ambiguity then. If gene is positive, it is SCA12. There may be some other conditions also along with that, but it is SCA12. So gene test or blood test, a simple blood test that helps in nailing the diagnosis.